Gentlemen, if you're over 60 and your erections feel weaker or less reliable, one of the biggest culprits may actually be the way you masturbate. Most men never hear this from a doctor, but subtle mistakes in grip, speed, stimulation, and breathing can numb sensitivity, choke blood flow, and train your nervous system in the exact opposite direction of what you want in the bedroom. The good news is simple changes can help you recover sensitivity, improve circulation in the penis, and rebuild confidence. Stay with me, because in a moment, I'll walk you through a 60-second reset you can use mid-session to restore sensation and blood flow without losing the mood. I'm Dr. Marcia Angel, a urologist with more than 30 years of experience helping thousands of men restore sexual health and confidence. This is educational, not medical advice. Talk to your physician for personal guidance. If you find this helpful, subscribe, hit the bell, and type 1 in the comments. If you want me to cover it differently, type 0 and tell me what to change. Now, let's make this practical. Why does this matter so much after 60? Erections depend on smooth blood flow and a calm nervous system. As we age, vessels can stiffen a bit and nitric oxide signaling declines, so your penis becomes more sensitive to anything that restricts circulation or spikes adrenaline. Many men also start testing themselves alone, which adds performance anxiety to a moment that should be relaxed. When you pair a tight, fast, dry routine with tense breathing and anxious thoughts, you train your body to require more friction and more stimulation to feel the same. Then in real intimacy, where the pace is slower and the sensations are different, everything feels dulled or unreliable. Here's the simple science to keep in mind. Erections are a parasympathetic event, the rest and relax side of your nervous system. Adrenaline and tension pull you out of that state. Think of blood flow like water moving through a garden hose. If you squeeze the base of that hose, pressure drops at the end. A clenched fist around the penis or a tight pelvic floor can choke the hose, while breath-holding and racing thoughts act like someone kinking it further. Sensitivity also depends on healthy skin and nerve endings. Dry, high-friction strokes are like rubbing sandpaper on the same spot. Over time, the skin gets irritated and the nerves feel less responsive. When you understand that, the fixes make sense. Set the scene so your body can cooperate. Warm hands, relaxed jaw, shoulders down, and a comfortable position that doesn't strain your lower back or hips. A little privacy and quiet lowers stress chemistry. If you're partnered, consent and communication matter. If you're solo, self-consent looks like respecting your own signals. If something burns or goes numb, you slow down or change it. Keep a simple, unscented, water-based lubricant nearby. It reduces friction and protects skin. A small, warm towel over the pelvis for a minute or two before you start can help blood vessels open gently. One pattern I see all the time is the iron-tight death grip. It feels effective in the moment, but it trains you to need extreme pressure that vaginal or oral sex rarely provides. Robert, 68, told me he'd been squeezing harder each year to feel anything. We changed one thing: lighten the grip to the point where you can still feel pleasure but not compression, add lubricant, and focus on a smooth, steady glide instead of crushing pressure. He grumbled for the first week. Sensation felt muted at that lighter pressure. But by the second week, his sensitivity began returning, and within a month, he was surprised by how much less effort he needed. Your goal is to retrain the nerves, not overpower them. Another modern trap is high-speed, high-intensity porn. It floods your brain with novelty and rapid edits, conditioning arousal to constant escalation. Then real life, which is slower and more intimate, can feel flat by comparison. Sam, 63, shifted to audio erotica and imagination for 2 weeks. No visual sprinting, just steady pacing and breathing. He was shocked that erections felt steadier, and climax returned without chasing louder, faster scenes. If porn has been your default, consider a short visual detox and a slower style that lets your mind and body sync. Dry friction is the quiet enemy. It irritates the glands and shaft, can cause micro tears, and over time dulls sensation. Lubrication isn't a luxury, it's protection for your skin and nerve endings. Warm the lube between your palms first so the first touch is comfortable. A small amount often goes a long way. Reapply before things feel sticky again. Men who switch from dry to well-lubed, gliding strokes often report that their penis feels warm and alive, instead of raw or numb after. There's also a mistake almost no one notices: breath holding and pelvic clenching. Many men bear down or grip the pelvic floor when arousal builds. That tension squeezes the base of the penis and can throttle blood flow. Henry, 72, had a habit of tensing his abs and jaw as he approached climax. He thought it gave him control. We trained the opposite. Soften the belly, exhale longer than you inhale, unclench the jaw, and let the pelvic floor drop on the outbreath. Within a few sessions, he noticed he could stay firm without feeling like he was wrestling his body. Here's a simple coaching cue. In through the nose for 4, out through the mouth for 6. Imagine the perineum gently relaxing on each exhale. Let me deliver the 60-second reset I promised. If sensitivity fades or you feel you're pushing too hard, pause. Release the grip completely, shake out your hand, and take 3 slow breaths with longer exhales. With your other hand, place 2 fingers just above the base of the penis or gently over the perineum and massage with light, circular pressure for 20 to 30 seconds. Think encourage blood rather than press. Add a fresh bit of warm lubricant, then resume at half your previous speed with a lighter touch, matching your stroke to your breath. 1 minute like this often restores warmth and sensation without losing arousal. Use it anytime you feel numbness, irritation, or performance anxiety creeping in. Timing and context matter more than most men realize. If you masturbate urgently right before sleep, while stressed, or as a test to prove you can perform, you're training urgency and adrenaline. Many men do better choosing a calmer time earlier in the day, taking a few minutes to breathe first, and not using masturbation as a performance exam. Frequency also deserves a thoughtful approach. Going from multiple times a day to nothing for weeks can both backfire. Some men notice their best balance with moderate frequency and a bit of recovery time between sessions. Pay attention to how your body responds over a couple of weeks and adjust toward what leaves you feeling responsive rather than depleted. There are gentle refinements that compound the benefit. Variety helps retrain sensitivity. Alternate your hand position occasionally, change angles, and include the shaft and base rather than drilling the same small area. If you've been rushing to climax, explore a slower build. Think of arousal as a volume knob, not a light switch. That steady, consistent rhythm often translates best to partnered intimacy, where patience and presence create trust in your body and with your partner. If you deal with persistent tightness in the hips or lower back, a few minutes of easy hip openers or a warm shower beforehand can relax tissues that otherwise tug on the pelvis and sap comfort. For men concerned about ejaculation control, start-stop is your ally, but use it wisely. Bring yourself to a strong wave, then back off slightly, breathe, and return to the same gentle pressure and pace that felt good a moment before. The mistake is changing everything when you resume. Your nervous system builds momentum on consistency. And remember consent and care even in solo practice. No forcing through pain, no ignoring numbness, and no punishing self-talk if your body needs a moment. A word about health and safety. If you have diabetes, neuropathy, or take medications that affect sensation or blood pressure, be extra careful with pressure and duration. Small adjustments may be enough. If you notice persistent pain, curvature changes, or bruising, see a urologist. If anxiety is a big part of the picture, brief breathing practice before you start and choosing softer, less stimulating inputs can lower adrenaline. The goal is to give your penis an environment where blood can arrive and nerves can perceive, not to win a race. Let me tie this together with one more story. James, 70, came in saying, "Doctor, I can get hard alone if I squeeze like crazy, But with my wife, I fade. We changed 3 things. He replaced the tight grip with a lubricated glide, practiced the 60-second reset every time sensation dropped, and did a short breathing set before any sexual activity. 4 weeks later, he told me, "I don't feel like I'm fighting my body anymore." His erections weren't just firmer, they were less fragile, and his confidence returned because he wasn't relying on force. If you remember nothing else, remember this. Erections thrive on blood flow and a calm, responsive nervous system. Choose a lighter, smoother touch. Protect your skin with lubrication. Breathe longer on the exhale and relax the pelvic floor instead of clenching it. Slow the pace so your body can keep up, and use the 60-second reset whenever you need to restore warmth and sensation. Treat masturbation as practice for the kind of intimacy you want. Steady, patient, and present, rather than a fast, high-pressure test. Some men notice positive changes within days. For others, it builds over a few weeks. Either way, these are changes you control. If this helped you, subscribe, tap the bell, and tell me in the comments what shifted for you. You're not past your best years. With small, intelligent adjustments, your penis can feel more alive, your erections can feel steadier, and your confidence can grow. Give yourself the patience you'd offer someone you love. Your body will often meet you there.